it's been very exciting to establish very specific, refined strategies for organizations that then helps refine their marketing and go-to-market strategy for the future.
Yeah.
And ultimately means that they are more financially stable and can do more of the work that they were, founded and intended to do, which is to take better care of their community patients and members.
So basically, I feel like what you and your team do is deliver those aha moments where you're able to walk away and people are able to really have a better sense of what they're doing, the direction they're going, and how to move forward in a very.
As healthcare marketers, we know three things to be true. Helping people is why we do this job. What's expected of us can get overwhelming, and there's power in community. Join us each week for stories of marketing struggle and success as we build the community to answer that question. What is the move in healthcare marketing?
Data directs everything. We have more data than ever to guide our marketing strategies. But when it's all said and done, the most important data in healthcare revolves around receiving payment and ensuring the best negotiated rates for the services you provide. From there, we can have peace of mind that our marketing strategies are data-driven to provide the organizations the best ROI on the services provided. Hello, I'm Larry Williams with Unlike Health. Today, we are thrilled to have our very own Kevin Thilborger join us for a conversation. Kevin is Unlike's Chief Managed Care Officer and a seasoned healthcare strategist with 25 years under his belt. He's a maestro of care transformation, helping institutions large and small navigate the complex transition to value-based care, from negotiating care contracts to enhancing operations. Kevin's insights have reshaped healthcare delivery across the nation. I hope you enjoy our conversation detailing how to take the guesswork out of growth. All right, welcome back to The Move. We got Kevin Thilborger with us today, and we're going to speak about all things managed care. Really excited about this conversation. It's a conversation where I expect to learn a lot through this process. When we joined the Unlike family in November of 2023, a lot of conversation about performance marketing, which I was solid on, ROI insights, got it. Then we started speaking about managed care. And I was like, hold on, I need a little help. But the more I did my research and learned about how this really helps, healthcare providers, it's really a game changer as we take you're able to ensure that you're getting paid the right amount for the services you provide. That increases the revenue while providing the metrics. You use those care and those metrics to improve marketing strategies and to make sure you're providing the services that fit your organization, pull in more qualified leads. It brings in business. Then it goes in that full cycle of making sure you're paid the right amount for those services. So, Kevin, thank you for joining us. How close was I on just detailing what that cycle looks like?
No, that's absolutely correct. I mean, this is one of the many reasons I joined Unlock was the joining of the actual marketing strategy to the revenue strategy, which then ultimately makes you think about which payers you're going to be in business with and which ones you won't. So great summary.
Oh, thank you. So when it's all said and done, this really takes the guesswork out of growth. I mean, we don't want to throw darts at a board, but we want to be as specific and intentional about our strategies as possible. And we don't really know that until we really understand the payer and service model. Is that the right way of looking at that?
That's true. And it answers the question that so many CFOs have for their chief marketing officers or VPs of marketing, which is, well, I spent a certain amount of money. How do I then attribute that to a return on investment? And part of that is actually tracking the type of business that was brought in, not just the actual visit, but was it Medicare, Medicaid, or Aetna, Blue Cross, or Cigna commercial business, or something else?
Yeah, it's and so when we think about that, can you go into really what those managed care services look like and highlight the effectiveness and quality of the services that's provided under that managed care umbrella?
Sure. So the first thing we like to think about when we're having conversations with marketing leaders and finance leaders are asking them, what their overall business strategy is, as well as their business development plan. And then looking at the tactical plan and asking the question, well, are those two things aligned? And then very quickly after that, more than 80% of all revenue is negotiated with payers. So really thinking through who's in that 80% of revenue and do we have the right partners? And then answering the questions from there of evaluating those partners. And so many of the unlocked managed care services include things like creating payer report cards, benchmarking payers from a reimbursement perspective to each other and to the marketplace. What if your joint replacements are 20% below everybody else's in the market? You might be a value add, but if you're paid fee for service in those scenarios, there could be a steerage opportunity as you negotiate those contracts in the future. And then supporting all the negotiations and strategies behind those payer strategies as you implement them, as well as the comms and the communications, if you will, strategy of should I evaluate leaving a long-standing relationship with a payer? How am I going to communicate to the marketplace and why? So those are the services we provide.
That's really interesting because it's not only about the marketing metrics to engage potential verticals, but it just really ensures that you're in the right spaces to begin with. How do these services help you understand how you compete with other regional providers, which some might call competitors?
Sure. So if you're thinking about, let's say, community hospital A versus community hospital B in that same community, we have the capability to pull the compares from your actual reimbursement to each payer's reimbursement for your competitor in the marketplace, or maybe it's multiple competitors. That then allows us to inform our negotiation to say, well, are we at the top of the market for reimbursement, or is there room to grow? And maybe there's only certain spaces where there's room to grow. And at the same time, we want to know, well, if there's room to grow in the community for reimbursement for a certain set of services, let's say OB, but we're not adding any more OB services or providers to our health system, then that might not be a place where we'll actually realize dollars because we're already at capacity and there's technically no room to grow and no recruitment business development wise to bring in additional OBGYN providers. So making sure all those things are connected, that we are benchmarking the rates so that we actually realize those yields on the back end is important.
Yeah, that's really interesting of how you can pull all this information to make sure that your future strategies are in line with the growth of the overall organization. Once you have this aligned and you say that, okay, this is the right group that we want to service, these are the right services we want to provide, how do you take that information back to your marketing strategies? Is it more of identifying the different services that we want to focus on, or can you go a lot further into the specifics of what works well, what doesn't, or who do we approach? I mean, I didn't know if we get into somewhat of a buyer personas at that point.
Well, I would say that from our perspective, when we're looking on the managed care side of the house, right, we're looking to see what's actually available in the marketplace. And then we would want to partner with our client or chief marketing officer, right, to say, well, what do you believe your brand strength is and right to win this additional new business? Then we want to talk to the operations leaders to say, can you actually ingest this new business in a timely fashion? If you're 9 weeks out for an appointment, you probably, and no one else is, then you probably are not, you don't have as much right to win. So if we spend the time negotiating better rates for those services, but we can't bring in any more services because we're at capacity, that's a challenge for the client. And that's where we want to make sure we're really thinking through the alignment of the dollars, less so the personas. Now, the makeup of then what that new business might look like if you can ingest it is really understanding how does it actually pay you? How are you reimbursed for that particular service? Are all the new knee replacements that are going to come in, are they paying you at Medicare or at cost, below cost, or are they paying you at 300% of cost? And there's an opportunity to support your margin and revenue enhancement, which then allows you to treat more of the mission-based, faith-based population health needs that your community has. Is that helpful context?
That is great. And I learned a lot through just that one, us just discussing that aspect of it. But what I really took away from this is not only about really receiving the correct payment for the services and billing for those, but at the same time, like it's really about running diagnostics for the healthcare provider, just to find out like, okay, this is what we're really good at. This is what we're really efficient in. This is what's not working well for us. Beyond, everything else we spoke about within the strategy, the marketing, and receiving, the correct compensation for the services, I feel like this is really an audit to find out where you stand within your market, within the healthcare landscape and what you specialize in.
That's right. We're spending a lot of time right now with clients trying to figure out, you've inherited a certain set of historical relationships in the community, whether that's with, Medicare Advantage payers, otherwise known as MA, managed Medicaid, or in California, managed Medi-Cal, and then the commercial payers. And then the question becomes, well, some of these payers in certain spaces have now become our competitors as well. And so really evaluating, can I actually collect the rates that I've negotiated? How many denials are there? And really looking at a bunch of key performance indicators to understand what my relationship looks like. And should I actually have that relationship going forward when capacity in my organization is so tight right now that maybe I only want relationships with best-in-class payers going forward? And if that is how I function, then how am I going to communicate to the marketplace that I am unraveling the relationships that are happening? If you look, for example, at Scripps, longtime Medicare Advantage participant in Medicare HMOs. And after 30 plus years, they've decided through their strategy to no longer participate in Medicare Advantage HMO products in San Diego. That then led Blue Shield of California to say, well, we will offer Medicare SUP plans to all of those same members at no additional underwriting. Now, if Scripps keeps that member, right, and they transition from an MA plan that was not reimbursing them at cost to a Medicare SUP or Medigap plan that reimburses them at cost, they're still treating the same member, they're paid more, and they're doing so with less financial administrative burden, which then allows them to direct more resources back into the community to the mission they were originally opened for.
That's really, really cool. Just because there's so much that can be, so many efficiencies come from, this managed care model. And we're beyond attracting new clients, we're being compensated for the right amount. You're able to really grow your relationships within the community just by focusing on the right infrastructure. I know we talked about lead generation, but I'm guessing this also helps client retention as well.
Absolutely, because if you already see patients today, but then, for example, I go to a very well-branded academic medical center myself in Chicago. But as a standing patient, it takes me 9 to 11 months to get my annual endocrinology visit. That should not be the case. And if anybody needed additional support constructs and had more endocrinology needs than I do, I can't imagine how often they would have and how far out they would have to schedule those appointments. So you can imagine the type of stress that leads people into. So again, really being able to evaluate who you're going to serve, how you're going to collect that revenue, and then how you're going to interact with your patients on an ongoing basis. Obviously, it has huge repercussions in whether it's HCAP scores, quality scores, or Medicare Stars scores.
It's so you can really reinvest in your efforts and connect more with the patients and the services that really fit you. Understand that you're being paid the correct amounts. You reinvest in those efforts. You can continue to grow that base by adding more physicians, and then like working within the service lines that you're going to be able to grow on a much deeper level than ones that just aren't really helping anybody.
That's right. And it could be that it's a combination of, and it may not just be physicians, right? It could be a combination of physicians, PAs, telehealth, and virtual care services through a JV partnership, or community outreach needs, depending on the community that you're actually serving and how they interact or find healthcare.
Yeah. So when we think about this all sounds great. We've talked about like how this is like running diagnostics that you can really understand, the foundational structure of your business and what's working, what's not. What's the steps to really implement a managed care process, or how would you say that? A managed care,
Just a revenue strategy,
a revenue
right?
strategy. Yeah. So what are the steps you would recommend for a revenue strategy like managed care?
Sure. I would say while there are lessons to be learned in the community and elsewhere across the country, you have to stop thinking about, well, if so-and-so is doing this in another community, if X hospital is doing this in Salt Lake City, but I'm in Atlanta, am I really serving the same population? So the first thing is, where am I investing, and is my strategy aligned with where I'm investing and what the community is asking for? Second, is really evaluating what my partnerships in the community look like, including with payers, and establishing whether or not those are going to continue to work for you as you evolve as an organization. Third is to then have a tactical plan to execute on that strategy. And while that's often table stakes, we all know that the strategies that we receive from very expensive consulting houses often sit on a shelf. And then at the end of the year, they're pulled out and we page through them to say, well, did we really achieve what we said we were going to? Fourth is to really align the clinical and administrative efforts. Having that dyad leadership model is key. And then finally, really thinking through then aligning your marketing strategy to steps 1 through 4, so that, again, you're going into the community with the same communication level that you're taking in step 1 with your overarching strategy.
That's so we're thinking about like a large initiative, but then at the same time, we're using a scalpel to really carve out the fine print, the fine details of really what's working and where to go from here. I feel like this definitely covers a lot of different departments and service lines. Who do you typically work with when you get this process started, Kevin? Like what type of you
I
connect
think
with?
it depends on the size of the organization. A lot of times it is initially to get the buy off. It is the chief financial officer and the lead marketing officer or VP or CMO. After that, it is a scoping mechanism where we may align with the leader over managed care, as well as operations and quality, to be sure that we're going to get the right sets of data to benchmark those payer relationships and rates at the same time, right? Like that we have to spend time with either IT analytics or a revenue cycle leader to ingest and review that data, and then make sure that we're aligned with the large strategy via the CFO and CMO before we take off with some of the work. And oftentimes this can be as small as a diagnostic and as large as a full-scale implementation, depending on what the client needs.
Sure. Thank you for that. So when you have these conversations where you're connecting the dots between the CFO and CMO, like what information do you typically ask for to start this diagnostic process to find out, okay, this is what's really going on?
Sure, it's an intake of a lot of the marketing plan, as well as the pieces that are going out or the content that's going out into the community, whether that's digital or paper. And then on the financial side, looking at value-based care reports, fee-for-service reports, any payer report cards they may have, their contract matrix, to understand how many relationships do they actually have, how are they performing to some degree, and then doing that diagnostic to say, okay, I think we have some disconnects. How would we like to move forward in the process? Where does the organization believe it can self-implement versus need some support from a third party like ourselves to help with that process?
Yeah. So you're getting a lot of this information. You're supplying a lot of information that's very helpful in many different ways. Have you seen any like sideways this has benefited an organization, a healthcare provider, of like, wow, I wasn't expecting that. But just due to assisting this group, you found these other ways that they've benefited?
Yes, there've been two projects so far off the top of my head that I can think of. One, where the benchmarking for both a private equity-backed single specialty medical group as well as a community-based health system, where they said that the benchmarking alone, because we can pull their direct competitors' payer rates, payer to payer, that's never been available before.
Wow.
And so we used to use an aggregated methodology for the market to directionally back into the numbers. And now with the transparency laws, we have the capability to pull that direct Aetna rate for all 6 hospital systems in a market so that you can compare to yourself to the other 5. And that's been super helpful for organizations to figure out their strategies. And then the unintended consequences were they just didn't expect the level of transparency we were able to give them.
Man, transparency is always nice. You can connect the dots between transparency and then using that information for future guidance. That's definitely a win for everybody. How does this, regarding the regulatory and also patient privacy, does that come into play through all of this?
Generally, on the revenue strategy and managed care side, the answer is no.
Okay.
When we then take the market data compared to the client's data and how you would then have to blind some of that to say, right, I can't give them a bunch of patient information that is not specific to them, therefore has to be tokenized. But you can show them what is available in the marketplace, right? And then they can make decisions about how to market. Again, I think the key there is to track it is the tokenization. But I can't speak specifically, definitely not an area of my expertise as
Sure.
it comes to as we get out of managed care and into marketing, how much deeper that data can be used.
Mhm.
Obviously, the health system can use all its own organization. Now, how it then releases that organization or markets to that particular member, they have to be thoughtful because, obviously, we don't want anything HIPAA related to have a violation.
Yes, always have to be cautious of that. When we think about the future in what we're doing, both unlike health, but at the same time, some of the stuff you're working on in the managed care side, what are you excited about as we move forward?
Again, I think one of the things is just the amount of interest that's occurring in having those conversations of making sure that chief marketing officers and chief financial officers are speaking the same language, that they actually understand each other has been a lot of fun for me.
Yeah.
And then diving into the level of transparent data that we've, after doing this for 25 years, I've never had it until
Mhm.
last year. And so it's been very exciting to establish very specific, refined strategies for organizations that then helps refine their marketing and go-to-market strategy for the future.
Yeah.
And ultimately means that they are more financially stable and can do more of the work that they were, founded and intended to do, which is to take better care of their community patients and members.
So basically, I feel like what you and your team do is deliver those aha moments where you're able to walk away and people are able to really have a better sense of what they're doing, the direction they're going, and how to move forward in with a lot of positive momentum. What's the typical response you get once you have these conversations and you wrap up your work with these providers? I know it has to be positive. I'd love to get your insight on that.
Sure. I think that usually the organizations are quite happy with the level of detail we're able to provide them. As we've supported them in the negotiations, they have much better outcomes than they've had historically. One, because of the data-driven approach, but two, bringing that both national and regional perspective to their local contracting has really helped them to see that they have to think about these relationships with payers in a completely new way um, that they've had to historically. So I think everyone walks away pretty happy, even those, and I can say this, even the most defensive of managed care folks who oftentimes are very knowledgeable of their marketplace. We just bring third-party data that helps them achieve their goals.
Mhm.
And then, of course, that ultimately makes them much happier because they get the support that they need from leadership in the organization to really drive forward and have the assertive positioning that they need for the financial stability of the organization going forward.
Yeah. I feel like so much of what we do within the healthcare structure is just really being intentional, whether it's being intentional in terms of, patient acquisition to, leveraging that data, the information we have and then also being intentional with the marketing ROI that we can provide. And I appreciate pulling all this information together. Now, if someone wants to know more about how they can go about leveraging this information or pulling more information from your team, how can they go about doing so?
Sure. I mean, just reach out to us. You feel free to email or call me. I assume you'll share my information after the
Yes,
podcast.
everything will be in the show notes. So the lots of contact methods there.
Yeah, and happy to have those conversations, whether they're over a Zoom call or in person. The team and I have worked in almost every state in the nation, so we certainly have the time and the experience to support a lot of those folks that would like to talk more.
Great. And there's a great article that we published recently. It's have to remember the 3 pain points and opportunities finance and strategy leaders are facing in 2024. Is that a great article to also add to the show notes?
Yes, you should. It just gives the context again of what we've talked about through the article, that you can have the best strategy in the world, but if you're capacity constrained or you can't hire into the market, it makes your marketing strategy that much more difficult. And then finally, of course, evaluating whether or not you're going to participate and partner with whom. There are some interesting statistics in there to know that you're not alone, right? In your healthcare leadership journey.
Yeah, I think that's the mic drop for this episode. Kevin, thank you so much for joining us. We spoke to John Lynn in an earlier conversation, and he spoke about how he's excited about how we have the data and how we can leverage that. And your team is doing a great job with that, which is really guiding future decisions. So thank you for what all you and your team are doing, and look forward to hearing more about that.
Great. Look forward to working with all the folks out there in the podcast world. Thanks for having us on, Larry.
All right. Appreciate it. Thank you, Kevin.
All righty. Take care. Bye-bye.
I hope you learned as much as I did in this conversation with Kevin. Recap. Takeaway 1. Think about alignment in dollars and not personas. Track the type of business, not just the actual visit. Kevin recommended the CMO find out their brand strength and go to the operation leader to find out if you can ingest the new business. Takeaway 2. Over time, there are typical historical relationships in the community that haven't been audited. Leverage revenue strategies to determine if you should have those relationships or if capacity is too tight. If so, how do you want to proceed moving forward? Takeaway 3. Make sure the CMO and CFO understand each other and pulling from the same data. Establish very specific, refined go-to-market strategies for organizations to create financial stability and focus on the work they are intended to do. Thanks again to Kevin for his insights today. I took a lot of notes. I'm sure you did as well. Until next time, onward and upward.
Thank you for listening to The Move in Healthcare Growth. Add your voice to the conversation. Email the show at themove@unlockhealthnow.com. Follow us on social media and stay up to date at unlockhealthnow.com. Also, be sure to subscribe wherever you listen to podcasts so you never miss an episode.